All right, so we have our very first episode of the Strength Doctor Connection, and I can't think of anyone better to have on than Kathy here. Kathy is a business executive coach, and you worked with quite a few major companies. She's a specialist in emotional intelligence. We literally just linked up on the phone a couple days ago, and I said, I've got to have you on my first podcast. So here she is, and yeah, thank you so much, Kathy, for coming on today.
Well, thank you for having me. You know, I'm very passionate about this, right? So
I could tell, right?
We got connected, right?
Yeah.
So I think that if more people understood what my work is rooted in, which is attachment theory, but it's really not a theory, it's a fact. And so there are some things that are theories, and there are some things that are facts, but maybe called a theory. And so attachment theory is integral to who we are as human beings.
Yeah. We were just talking for, I think, 1 minute, and then we somehow dove off into the direction of, I was telling her about one of my patients that I had come back. So I'm a naturopath, for everybody that doesn't know. I do everything from physical medicine, acupuncture, herbal medicine. We do regenerative injections, and I do quite a bit of primary health care as well. And I've had quite a few patients that I really just don't understand them because a lot of things that seem easy to me seem easy for a lot of people are not easy for a lot of other people. And I think I was telling you about a lady that I had that was coming into the clinic, and we did some blood testing, and she had extremely high blood sugar, and I mean like really, really high, and that she needed to be on medication like that high. Not like pre-diabetic or borderline diabetic where let's try diet and exercise first. Like she needed to be on medication like yesterday. And so she'd already told me she'd been to her conventional doctor, and they tried to put her on metformin, I think, and some other basically blood sugar lowering drugs, and she didn't want to take them. That's why she was here. She said, I don't want to take drugs, and I said, okay, well, you do need to understand how high, number one, your blood sugar really is. And if you're going to do this the naturopathic way, then you're going to have to do some lifestyle intervention. And you're going to have to eat better, and you're going to have to exercise, and do those sorts of things. And are you interested in doing that? I said, first off, I do think you need to be on medication.
And I'm sure
she was very adamant to say, do what?
She's going to say yes. She was going to want to do it, right?
She did not want to be on medication. She's like, no,
right,
no matter what.
She's going to say that she's going to want to do what you say.
Oh, what I want to do. Yeah, right.
So I'm sure as the story evolves, we're going to find something different.
Yeah. She was so adamant about doing this, what we discussed on that first consultation visit, and next week rolls by. I have her come back. I'm asking her how you doing with the dieting, how you doing with the exercising, and that sort of thing. And I haven't done any of it. And I haven't changed anything. Well, nothing's changed. Are you drinking more water? No. So nothing changed. Week 2 goes by. You get it. Week 3, nothing had changed. And I just kept telling her the same things, like, we need to get you on medication. Will you take it? If you're not going to do this lifestyle intervention stuff. And she wouldn't do it. So and then basically you explained what was going on with her to me, and it made so much sense. So if you can explain to everybody what could be, right?
Sure.
What could be going on with her, because I knew, it was a trauma that we're dealing with here. Like, I'm just sitting here going, there's something going on here that I don't understand, but it's there, and it's the root cause. There's so many people, I told you this the other day, that so many people know what to do. Like, if you can Google a diet plan, and figure out how to lose weight on your own. And like, there's so many people that know, like obese people that know what to do, but they just won't do it.
Right.
And
so what gets in the way, right? So why do intelligent people sabotage themselves? Knowingly or not? And so when you brought that up to me, I think I probably laughed when we were talking, and you're like, well, that's not really so funny. And I said, well, it is when you understand attachment. And so when we started talking about it, I explained to you that attachment's like the GPS for our lives. And in terms of attachment theory, it's called the internal working model. So an infant learns who it is in relationship with its mother. So it creates what I expect for myself, other people, and the world. And it's through the relationship with the mother and child that this develops. So to the degree a mother is attuned, sensitive, responsive, predictable, and differentiated with her infant, she can create a sense of felt security in the infant, which allows for the somatic development of the infant, because we know that humans are born somatically immature, right? So the nervous system's not developed, the brain's not quite developed.
Extremely immature for years, right?
Right, and so it requires a sense of a safety, a felt safety within the infant for the infant to be able to develop. But we know, so a shocking thing to me was discovering that, and being a mother myself, there's no such thing as maternal instinct. And I was like, really? But then I started thinking about it, and it's true. We learn to be mothers through the experiences that we had, and that's why they say this goes generation to generation. And so, and it's also reflected on like what happens societally. So you think about it, used to be like, oh, let the baby cry it out. Oh, what are we saying? Oh, we don't really care so much. What we really care more is that you do what we want you to do, right?
Because I said so.
Yeah, or if I hold you too much, I'm spoiling you. Like, how could you really ever spoil a baby?
Right.
You can't.
Yeah.
But there are these memetics that are out there that people ascribe to, and it's like, well, I better let my baby cry it out so they get on a schedule because that's a good thing. Well, for who? The baby or for you? Right? So what we know is that there's like 4 basic styles, and so like we're not a type or whatever, but there's enough of delineation that you can kind of see like where people go. So secure attachment means that, you had good enough parenting that your mother was responsive, you feel good about yourself, you feel good about others, you feel worthy of love, that I know as an infant, even though you don't have words yet, that my needs are going to be responded to, right? Somebody's going to be there and take care of me. Then there are going to be 2 styles that are considered insecure and organized, which are avoidant dismissive and anxious preoccupied. And anxious preoccupied is sometimes called anxious resistant or anxious ambivalent. So they have like a lot of different names. It just makes it a little bit more confusing. And then the last style came out, and this is really based on John Bowlby's work, but Mary Ainsworth came out, and she came up with a 4th style. It's called disorganized, meaning that it's a type of a child that had a mother who might have been has her own unresolved issues, right? So not having worked through them, she projects it onto her infant. And so despite good intentions, instead of calming her child, she arouses the child's nervous system and causes anxiety. So the mother could be threatening, could be causing frustration for the infant. And so the infant doesn't really develop a good strategy for how to get its needs met, right? And so what we know about the secure person, and they'll say that 60% of people are securely attached. I have yet to see it. I've been doing this type of work on my own, so I worked in corporate for over 20 years. I've had my own executive coaching practice for 10 years. I've done a lot of consulting work. I don't really see a whole lot of security today. It's easy to be secure when we're not threatened.
Right.
It's more challenging when we feel not just physically threatened, but emotionally threatened.
Right, yeah.
Does that make sense?
Yeah, 100%. I don't think there can be enough talk about the family. I think we mentioned that before, and the development and what goes on, and everybody's always, in naturopathic medicine talking about the root cause. Well, what you're talking about here is the root cause for a lot of stuff, especially if, the child's needs weren't met, and that makes, you can just trace it back, and then that makes sense probably why they did this, and why they did this, and why they behaved this way. And, it's just, I've read Donald Kaust's work, The Inner World of Trauma, and, basically he was saying that when something overwhelms the circuitry of the brain, basically it kind of cocoons and basically arrests the child's development at certain stages, and Freud had his stages, which, you know, I think was a little excessive, you know, just all about sex. I think we're more than sex, you know.
Libido.
Yeah, all about the libido frustrations and stuff like that. And then, you know, the fixations that people get into, the oral and anal and phallic and all that. And it's so interesting, you know, all of this. And then, yeah, I've read Freud's work pretty extensively, not as much young as I would like. And then you mentioned, what was the other guy you mentioned?
Bowlby.
Bowlby.
John Bowlby, right.
Yeah, never read any of his stuff. So
And
all
it's
this is making sense. And
right.
yeah, it's kind of interesting to tie all them together too.
Well, because a lot of the Freudians, Neo-Freudians, were the people that Bowlby worked with. So Melanie Klein, John Bowlby, Winnicott, Fromm, were like post-Freudian. What happened is around this time that the work was coming out, late 40s, early 50s, is also the time that they were fomenting feminism, right? So attachment theory was deemed like old-fashioned, or it was bashing the mother. But it's still human reality. So what we see that we're living in now could be called like cultural Marxism, postmodernism, and so it's almost as if the role of the mother was diminished. And today, you'll hear the mother is referred to as the primary caregiver.
Right.
Because there's this diminishment on the relationship between mother and child. And you ask, well, where's the father? Well, the father is really important, because to the degree the father cares for the mother and the mother feels safe and secure, then she's more apt to exactly care for the child.
Yeah, and the epidemic of broken homes.
Yes, it is an epidemic.
Yeah. So yeah, I could go on about feminism.
Well, you know what else is really important about that is, and this is in no way a negative thing on sexuality and what people do, but what's really important between mother and child, when the mother can be calm and relaxed and is breastfeeding, because that's another thing they encourage bottle feeding, right? Because there's that breakdown, there's not that somatic connection between the mother and the child any longer when they're not breastfeeding, right? And so when a mother breastfeeds, she has a release of oxytocin.
Yeah.
And then that mirrors within the infant the release of oxytocin, which promotes the healthy development of the nervous system, the prefrontal cortex, hippocampus, and the occipital lobes, right? So think about if you have, unfortunately, let's say a mother dies, or there's just two men raising a child. Men don't tend to have that same impact on the child where they release oxytocin, right? So if you have these types of relationships where, you know, they're different, it's going to impact the development of the child.
Right. Would you say that fathers become more important later on, but there's no replacing of that? You know, the mother for how many years would you say?
The father is important. Well, things start to change around the age of 3 when children start getting into the stage of exploration, right? Exploration is really important because if a child feels more secure, they're willing to go out and explore, right? If a child is avoidant, that child's going to go out and the mother's going to be like, don't do that, you're going to break something, and the child's not going to have as much regard for the parent, right? The anxious, preoccupied child's always going to be looking back at the mother, like, what does my mom think? You know, is she still going to be here? And so what's going to happen is there's going to be an inhibition to learn. Because learning's going to trigger negative affect, right? So for the child that's anxious, preoccupied, that meant that mother might have been intrusive, not always consistent with the child, sometimes there, sometimes not. The good thing about it is they had the connection. The challenging thing about it is the anxiety, the hypervigilance, the fear of abandonment, really profound vulnerability. It's almost as if
the fear of abandonment so much in men and women these days,
Really?
Oh, yeah.
And I said to you before.
I have a lot of friends, who have fear of abandonment. Males,
And think about what that does in society. So I know we're making some jumps here, but think about what happens is when, you know, males are supposed to be the foundation, and when the man's feeling insecure and feeling abandoned, or risking abandonment, and then comes in relationship with a woman, then the woman's acting more masculine. So we see men being more feminized and women being more masculinized. I see this all the time.
Everything's, flip-flop.
And then what's the child supposed to think?
Yeah.
Right?
They're confused.
Exactly. And what happens from confusion?
Yeah.
You know, it comes up like, I'm so angry. No, you're not, Billy. You love that. It's like, no, I don't. It's like, yes, you do. So we get these conflicting messages that the way that I feel and what I'm experiencing isn't what I'm experiencing. So I learned to split that off, and I adapt to what I know is going to make my mom, my dad, my family happy. Right? So I learned to be who I'm not.
Yeah. So that's a big thing that I talk about quite often is, with the postmodernism and like the new normals, like let's just say testosterone, for example, in men has been declining 1% ever since I think the late 70s and 80s every single year on the average of their testosterone levels. So should we look at 2020, what's average, or should we look back to 1970, what's average testosterone levels? They're turning everything into a new normal.
Right.
It's like, but we're drifting away, and to me, like, how do you know it's normal? It's just like, okay, well, I'm not God, and I didn't create us and nature and everything, but I would argue the most normal is how we evolved and how we've been living together in communities and as families for eons. Okay, not just the last 100 years where things have changed so much, so fast, we haven't been able to catch up to it. And then, do we want to keep up to it? Is this new normal the thing? So aligning with nature as much as possible to me is what is most natural. So and how we behave. It's like you wouldn't take a lion from the jungle and say that his habitat in the zoo is what's best for him, would you? So why do we think that, and lights and all this stuff and how we're living in this new modern world, sitting all day, we have all this blue light exposure, all these plastic bottles, all these chemicals that we're exposed to. That's not normal, So what can we do about it? Well, we need to strive as much as we can back to that normal.
Well, and help people understand what it is because of clarity. So here's the other thing. So I did a lot of studies on cybernetics and social engineering. And so what happens is that there's so much information that it overwhelms people. People are literally overwhelmed by information today.
Yeah, it's too much.
And information causes cognitive dissonance. And so cognitive dissonance arises when you say something that challenges what I most deeply believe, right? And as a result, I have to either have the wherewithal to say, I'm going to listen to you, just be curious and ask a question, even though I don't agree with you, right? Or I'm going to dismiss it, I'm going to make fun of you, conspiracy theorist. Right? I'm going to I'm going to diminish you in some way so I feel more comfortable.
Put you in a box some way. You got to categorize what you're saying.
I'm going to label you in some way.
Label you,
Right.
Yeah, I see that so often. A lot of people ask me questions. Should I do this? Should I do that in medicine? And
Can I just interrupt you?
Go ahead.
They don't want to know. When they ask you the question, they want to defend against how they're going to do it. So it's the sucker punch. Like I'll have clients say, so Kathy, what do you think I should do? And some of them caught on because they know what I'll say. It's like, that's really curious. What do you think you should do?
Yeah.
I don't take the bait.
Right.
Because people don't want to know.
Yeah.
Like, have you ever been in a situation where you want to do something and somebody then tells you to do it, and then you're like, I don't really kind of feel like doing it anymore.
Right. Yeah. I had a lady the other day, and I was, she comes back all the time. And I literally was like, not even going to ask her about smoking till the very end, because sometimes I led with that. How's this? How are you? The smoking cessation going. And then towards the end, she's like, and I've been smoking. And then I was, telling her, I was like, well, okay, she's like, but I'm not smoking as much. And I'm like, well, that's good. As long as you're moving forward. And she's like, I didn't think you were going to ask me. And I was just like, well, I was just giving you a little bit of a break from just sitting up here telling you what to do all the time. And then after I said that, then she like kind of relaxed, just kind of like what you're saying. Like, yeah, I know what to do, but.
She wants you to shame her. So, here's a paradoxical thing. People want what they say they don't want. So she wants you to be her surrogate parent. Well, did you check up on me? Well, Daddy, you didn't even ask me about smoking. You don't even care about me. You know what? If you really cared about me, the first question you would have said to me is, have I been smoking?
Yeah.
So it's a gotcha.
Yeah.
And you've got to track with it, because this is the thing about humans. They're very clever. And like when you and I spoke, I said, I'll have a client say, you're never going to believe what happened. And I'm like, yeah, unfortunately, I'm going to believe it.
Yeah.
Because I understand human nature.
Yeah.
Yet people think that they're logical and that they're rational, and they're anything but.
Yeah. Anything but. But yeah, I was just, how I normally explain things is like, well, like, should I do the ice bath? I do recovery days where we do the ice plunge. Wim Hof, you've looked into his?
Pardon me?
Wim Hof, you heard of him? He's the Iceman. You'll have to look him up.
Well, I like that. Those places you can go into, the cryo places, and they you freeze for like 2 minutes.
Yeah. Brief.
Is that long?
Brief description of Wim is he lost his wife in the 90s. He got very depressed, and he lived in Northern Europe. And for whatever reason, he would go out and swim by glaciers because it actually releases endogenous opiates when you do that. Like the cold morning shower releases opiates, you feel good the rest of your day. So he was doing that to battle his depression after losing his wife. And then he just kept doing it, and this kept pushing further and further and further. And then, like, he broke all these records. He submerged himself in ice for 1 hour and 47 minutes without lowering his core body temperature. He swam under an iceberg the size of a football field. He climbed Mount Everest in shoes and a pair of shorts. Unbelievable. Now he's like 61. He had a birthday a couple months ago. He submerged himself in ice for 61 minutes at 61. But he's a miracle man. But anyway. So we do the ice plunges. Where the heck was I going with this? So I was talking about, context dependent. When I have people ask me, well, how long should I do the ice? And it's like, well, that depends. Are you on the risk of, a heart attack? Do I think you're on a risk of maybe, throwing a clot?
Sure.
You shouldn't do it. You need to go get a stress test and then, lower the cholesterol. However we got to do that, Or if you're a young, healthy guy, first time, I've listened to your heart, you've got good cholesterol, all that, you're an athlete, try to do 5-10 minutes. Maybe next time you might do 12.
Right.
Maybe next time you might do 15. So everything is what I was getting at, like context dependent. Like you're saying, everybody wants to label you, or, everybody, wants to label the political candidate they don't like as this, right? And life is way more complex than that. So context is critical.
So I agree. So Kurt Lewin, brilliant social engineer. So Kurt Lewin's formula is called VUCA, volatile, uncertain, complex and ambiguous, and I would add paradoxical. And so they use complexity to overwhelm people such that they can't engage with complexity because, to your point, there's this oversimplification of things today. And people are pretty saturated. They can't take too much, And so when I was listening to you speak about the different things that you do, you're asking people to do something different that's outside of their pattern. And patterns,
when they're there, just say, hey, fix me today.
They don't really understand, they don't comprehend what that really means. Because they've been living their whole life the same life from the time that they were 18 months old. I mean, this is a really crazy thing that people don't get. Your internal working model, your attachment, is formed by the time you're 18 months old, right? And it's not really known because it was done before you had language. I can't recall the name of the therapist. He calls it the unthought known. Your body knows it, but you don't have words and language to it. And this is
so your subconscious is aware of it.
Exactly, and that's why you could get triggered. It's like if something happens, like sometimes people have a strong startle response, something will happen, the person's like, and it's like, why did you do that? And it's like, it's not like the person did it on purpose. There's an association, so the body's always ahead of the mind. At least by a few seconds. So the mind will try to rationalize what happened, but your body's aware. It's like the prosody of voice.
The body keeps the score.
Right. So
countless would argue that some people, they're totally detached from their bodies.
Well, they are, and that's dissociation. There are people who are detached from their bodies.
They'll even say, like, I can't really...
They don't feel themselves in their body. They feel numb. And many people feel numb today.
Yeah.
Because what they feel, they don't like what they feel. And so the other thing is that the intensity of what you feel now is generally linked to the past. So I had a client call yesterday, and we were getting to the pressure that she feels in certain situations about how she's being evaluated and judged. And I said, you know, when you have that big, when something that should maybe be a 3 out of 10 with 1 low and 10 high, you're indexing on it like a 10 out of 10. And I'm going to be transparent with you, it's not a 10 out of 10,
Right.
but it feels that way to you. So I'm not
Right.
discounting that it doesn't feel like a
See
10
that
out of 10.
in pain, yeah.
I'm not discounting that it doesn't feel that threatening. The thing is, how can you differentiate what is really a 10 and what's a 3? Especially when your body's telling you everything's a 10.
Right.
And that's the key to a lot of this, because our bodies can give us misinformation, but we conflate it as though it's real, right?
Yeah.
So we can feel threatened by something. So it can be a person's voice. Like a person who speaks in a monotone like this is very unsettling to people. You can't gauge where's that person coming from, right? A woman who has a strident voice or goes up too high, especially like with the executive coaching work I do, men will be like, oh my God, it reminds me of my mother or my wife, right? Seriously, but it's reality. So like, we laugh at it, but it's true. And so women really need to be aware of their voices and the prosody, the inflection. Is it interesting? Do I sound threatening? Because you know what? We tend to repeat things that we experience over and over again. So we repeat like what we experienced in our family of origin into the workplace. You can see people recreate the same dynamics over and over again.
Yeah. Yeah, we are creatures of habit.
Well, of pattern.
Pattern. Okay.
Yeah, of pattern.
Yeah.
And when you can become aware of your pattern, you can then begin to change it. So like you and I talked, I was explaining about this EQ assessment that I got certified in. And I took it and I was very honest and I got my results. And I'm like, that is just not me. There is something wrong with this assessment, because I'm reading through it and I'm like, nope, not me. So I had to fly out the next day to Santa Barbara to meet with the team and go through the certification.
Tell us the difference real quick, that and IQ. So EQ's
emotional intelligence.
Yeah.
It's about being able to take the cognitive aspect with the somatic aspect and make sense of it, right? And not to be overwhelmed. Like, so, I mean, I have been in situations before where something comes up and I'll feel like really anxious or threatened, and I'm like, is that really true? What conclusion am I coming to? If I come to a really quick negative conclusion or I feel threatened, the likelihood is that I'm not making an accurate assessment. I'm probably going to be experiencing what's happening now as an association with something that happened in the past.
Right.
And it's going to feel like now, even though it's not.
Yeah.
It's pretty amazing, isn't it?
It's super amazing.
And what I can say is I know this works because the person I was then, like I would have thought I would have had really high anger and really high shame, and it was the inverse. I had lower on both, and it's like, that's not me. And I went up to Jan, and I said, Jan, I don't think I took this the right way. I think I need to take it again.
Yeah.
And she looked at me and said, Kathy, just sit with it. And I'm like, fine.
Yeah, we think we know ourselves oh so well, and then
Isn't that
it's
the
like,
truth?
almost like looking back at your pictures, 5 to 10 years, and if you're not like, at least for me, cringing to a large degree at when you think where you were then and where you are now, and then you're going to do the same thing probably in 5 to 10 years, and at what level or whatever you think. So how could people become more aware of some of the things that may have affected them in their past, and where would you recommend most people start maybe doing some introspective work?
Sure. So Chris Fraley has done a lot of work on attachment, and you can go Google Chris Fraley and go to www.yourpersonality.com, and you can take a free attachment assessment. One thing I'll say is that oftentimes with self-assessments, we answer the way that we'd like to believe we are. And so there can be some distortion, but it's a good start. So I use an assessment where a person watches a series of 8 videos and they answer questions, but that costs money. So I like to have things that people can use that when they're interested and they're curious, they can start off and do something on their own. So I would encourage that, and I'll give you some links to that. So it's about becoming aware of, we use all the different attachment styles, but there is going to be like one type of style that we tend to rely on with different types of relationships, right? So I might have one style I use more with my mother, and my style with my father could be different. So let's say, for example, I might have a fearful avoidance style with my mother, but I could have a secure style with my father. And that adds even more complexity, because people are like, well, I'm not like that all the time. And it's like, yeah, I completely get that. With some people, we can feel more anxious. Other people, we can feel more calm. And so it's about learning this, because they're very predictable patterns, and they're very predictable feelings that go along with those patterns. As you can become aware of your pattern, that awareness, you can't change what you're not aware of, right?
No.
As you become more aware, you can recognize it's like, oh my gosh, my heart's starting to race right now, or I'm like, I feel lightheaded, or I got really angry. Those are all great indicators, right? Because what they can do is help to see that what I'm experiencing this moment might be overly intense. So as I become more aware of this, I can move from perhaps acting in a more insecure way. Not to say it's bad, like insecurity has gotten such a bad, why are you so insecure? Well, we don't even realize what that means. Like this work brings a new level of awareness.
Such a blanket statement.
Right, what does it mean to be insecure? Well, what kind of insecure are you?
Context.
Right? Are you avoidant insecure? Are you a preoccupied insecure? Are you a fearful avoidant insecure?
Right.
And there's a gift.
The differences are profound.
Exactly, and there's a benefit to them. So, like every emotion has a gift. So, for example, anxiety might be, there's a gift to that? Well, yeah, because anxiety tells you that you should be seeking more clarity. When people feel anxious, they want to move to action or behavior to ameliorate the distress, right?
Right.
Sometimes it's important just to sit with the distress and experience it in your body. Process it, yeah. And then think about what's the best action to take, if any, right? So the gift of anxiety is seeking clarity, right? Like sadness. So you might have clients that show up who, like on the preoccupied style and on the fearful style, you're going to see people who might have higher access to sadness because they have unresolved loss. They had a relationship and they connected, which is a great thing, but it may get caught up, like it's almost like sadness is like having gum stuck on the bottom of your shoe. You can never quite get it off, right? Yeah. It's kind of like that, it's like that low-level depression, and it can amplify to significant depression. But it's typically about loss, and it's about attachment loss. It's about not having the love that you wanted as a child and the way you wanted to be loved. It's like when you and I first started speaking, I said, there's that feeling of mind in mind when somebody says, oh my God, you get me.
Yeah.
I mean, people love that, right?
Yeah.
Because we're simpatico. You don't feel like a threat to me, right? When somebody's like, oh, gosh, they just don't get me. It feels threatening. It's like, I don't know what to anticipate. I don't know how to respond, right? And so it increases distress. Because we want to know, are you friend or foe? Right. My attachment style is going to also determine if I tend to be less trusting or more trusting, right? If I tend to be on the avoidance side, I'm going to be less trusting of others and more trustful of myself.
Right.
If I'm on the preoccupied side, I'm going to be more trusting of others and doubtful of myself. So I might go out to other people and say, well, what do you think I should do? Oh, what do you think I should do? What do you think I should? And it's like, oh my God, there she goes again. She's not going to take anybody's advice. She's going to do what she wants. And it's going to end up the same way again, right? We all know people like that. And it's like...
And then relationships, we were briefly talking about how that, like you said, two dismissive people won't be able to...
No emotional glue.
Yeah, no emotional glue. And then you got the preoccupied, you would relate
anxious,
that...
preoccupied, yeah.
Anxious, preoccupied, so that's kind of the BPD?
No, BPD
kind of
would be more, and we have to be really careful because people get really upset about these things. So I'd like to sometimes not get into that area.
Got it.
But that would be more in the fearful or the disorganized. Okay. And really understanding when we use labels like this, they can be helpful and people can also be very aversive to them, right?
Because then they're going to be reading about it on Google.
Exactly. Just think about even
they feel like you just went like this.
Exactly. It's
Got
like, I'm BPD, it's like would be deemed to be alexithymic. People look at the labels and then they think that the label is who they are, but no, you're more complex than that.
Right. And I see that so much in conventional medicine. They will throw a label on a
Yes.
patient. And, you know, I don't think, you know, I'm not a psychiatrist and I'm not a mental health expert, but I'm just very, very interested in the psychology, like we're talking about with my patients, what's going on. But yeah, I don't see the benefit. I totally agree with labeling someone like this, especially a mental, emotional, you know, human being doing that. And then they'll smack you with this label and smack you with a drug.
Well, serotonin, like, so for example, depression, well, we're going to give you an SSRI. Okay, but did you get a baseline? Like, what's my regular baseline for serotonin? How do you know that what you're giving me is correct?
Right.
Nobody even thinks about that, right? They're like,
Yeah.
well, just take an SSRI. It's like, well, what's that really doing? Or take Wellbutrin and like do something with dopamine. How do you really know what the effect is going to be? It's not like they did like a baseline sample in your brain is what your serotonin level was,
Yeah.
right? So what are we really doing? And it's not about a drug, it's about relationship. So if we're created in relationship, how do we think taking a pill is going to change what we learned relationally?
Yeah.
We learn, like, I have like friends who I've shared this with who
It's a band-aid like so much else in conventional medicine that doesn't work.
It's palliative.
Right.
You might feel better for a time, but it's not going to change the way you engage.
It's not the root cause. It's
Exactly.
not the source of the problem.
And so by understanding your attachment style, you can say, okay, this is how I might tend to be. This is where I may be challenged. And these are things I could learn, develop through. Because really, the insecurity and attachment is about what didn't get developed. And it's not about saying, oh, I got an F in life. It's about recognizing these are things that didn't get developed. Here might be some things that are overdeveloped, right? I might overly react to things, but what else could I develop?
Compensations.
Exactly. What else could I do? Right? How do I manage myself? Like, I'll have clients say to me, well, just give me a tool. And it's like, oh, the tool is your awareness. You know, somebody said, well, what can I do between now and the next time we meet? I'm like, well, just notice what you're feeling. That's not enough. And I'm like, oh yeah, it is, because you haven't been noticing.
They think that's like petty and just useless. Like, what is that going to do?
Exactly. Exactly. And yet.
Body awareness. Yeah. So we could relate this too to, you know, I grew up in Tennessee and we ate buffet and fast food all the time. I was an athlete, so I didn't watch what I eat, you know. Seafood is what we call it. Whatever you see, you eat. But I never forget when I first started cleaning up my diet, how the lack of indigestion and bloating and flatulence and belching, you know, like I started to clean everything up and then I hardly didn't have any of that. And so many people are so unaware, you know, of things they're doing in their lives, things they're eating, how they're moving, how their relationships are that are affecting them, and your body's saying, hey, and we're just so unaware of it, you know. And then but then for an objective way that people are more apt to not just say you need to quit eating pizza or whatever. They see dairy, bread, and all that on an objective sheet, you know, for a food sensitivity test, which actually those aren't the most accurate, but they give you a good indication and window most of the time, but they're not perfect by any means, perfect science. But yeah, so now they're saying, oh man, maybe I shouldn't eat dairy, shouldn't eat wheat, shouldn't eat this. And it's like they have to have that, a lot of people, just to even begin to think, you know, maybe I need to change something.
Because they've got a mental association with the food also. So the food also has an association, like almost a relationship, and so that's why these things can be so hard. So
you read the book Meet Your Happy Chemicals?
No.
Talks about differences in the delineations between serotonin, dopamine, and all that. You know, you eat carbs, serotonin. Anyway, sorry.
No, it makes sense. And that will go into attachment style too, because attachment styles are also going to be reflective of what's happening within the body. You know, all of these things. It's just like we had talked about before. You're going to see like people who are avoidant dismissive. You're going to see people who have more issues with migraines. People who are fearful avoidant, you're going to see more autoimmune, like fibromyalgia. Fibromyalgia is typically always associated with that, even MS. So, you know, our bodies are
doctors, are you listening out there?
for our emotional minds. Like, we like to think
Look,
it's...
hold that thought real quick, because
Sure.
I know so many doctors that have told patients with fibromyalgia that it's all in their head. And I remember thinking, well, that may be true, but what the heck does that do to help them? You know?
Makes them feel more shame.
And it perpetuates the problem.
Exactly.
So, you know, while partially you're like, well, I agree with that, this doctor maybe it's a half truth, right? Or I don't know, how would you say that? It's a label again, kind of, but
because
it's just,
people who have that sometimes can be frustrating because nothing ever really seems to work, and there really is something
they are really
that they're
feeling pain. Yeah.
because they typically, people who experience fibromyalgia don't really experience emotional safety.
Yeah.
They feel very threatened. They have very activated systems. They tend to be
So their nerves are
hypervigilant.
just on.
Yeah, and it makes sense. And I think it's really such a shame that we don't speak about it in this way to help people understand, you know what, this is the way you grew up. It's not to say that there's anything wrong with you, wrong with your family.
Right.
This is how it is. This is how you were
This
shaped.
is what happened.
Yeah.
Here's
So
the story.
if
At
you
least-
can then take that like assessment or get more comfortable with what you're feeling, it's going to be information that you can then use to create greater security for yourself, because you know the bottom line is no drug is going to do it, no other person is going to do it for you.
Yeah.
You know, it's really an inside job. We have to be able to do it for ourselves.
And that's what we get into initially. Like when I first started in medicine, like and I had a dad that had heart disease and cancer, still didn't want to, after the diagnosis, just wanted to, do the right things. And I just remember thinking, man, I wish I could just do this for him. And we've all felt that way, I'm sure,
Right.
with loved ones and people we care about. And just like, oh, why don't they just get it? And you want to do it for them, but you can't. And you got to teach these people these tools to.
They have to want to learn it. So
Yeah.
here's a frustrating thing I learned. Like, I was very naive when I first started doing this, thinking, oh, everybody wants to learn this. Like, if you share this, then people are going to navigate towards it, and they're going to learn it, and they're going to change. And it's like
naturopathic medicine is so magical.
yeah, and it's not going to happen.
Yeah.
And so facts don't change minds.
Right.
Right? A person has to want...
Emotions do.
Look, the emotions are the currency of the world. Why do you think they do what they do? They rile people's emotions up because then the person acts on the emotion as if though it's a fact. Because what happens is when the emotion gets aroused, it creates an association, right, of the past to memory. And then that feels like, oh, without you even being aware of it. And then boom, you're down the path, you're taking action already.
Yeah.
I know what this is. I know how this is going to end up. How many times do you have people say, well, I know what's going to happen next?
Yeah.
Right, because they already know they're going to act. So, of course, it's a self-fulfilling prophecy.
Yeah. Yeah, and changing people's feelings is...
But they can change. So here's a great thing.
You don't
And
change
I don't
it,
think
right?
my client would mind if I shared this. We were talking at one point, and she was saying, we're talking about something personal, because sometimes things come up personally even at work, right? What happens at home happens at work. You don't come to work and like hang your jacket up and like, I'm the human resource and I'm here now to do my job, right? No. So my client said to me, her husband said something, she's like, he made me so mad. And I'm like, really? He made you mad?
Yeah.
And she looked at me, she's like, you're screwing with me, aren't you? And I'm like, well, maybe just a little bit. I'm like, how do you get in your head and make you mad? I said, you made me mad. And that was like, how did I make me mad? Think about all the time.
The projection.
He made me, she made me, right?
Yeah.
It's like, where am I? And the other thing I noticed is like when people change their pronouns, it's like, you know how you do that, right? We all do. It's like, no, I know how I do that. So you'll notice at times when, see, I just said you'll notice, I notice at times. See how easy it is? It's so fascinatingly easy to change our pronouns. Instead of saying I, because there's a responsibility to it. I am stating something when I say I do this, versus, you know how we all do that.
Right.
We switch it around and we're not even aware that we're distancing ourselves from what we're speaking about.
Yeah. That's that RAS, right?
Yeah, reticular activating system.
Yeah, being aware of that too, right?
And that's interesting because it happens outside of your awareness. I mean, the human mind is just an amazing thing. It's an amazing thing to think that my reticular activating system, which sits at the bottom of the base of my brain, right, filters out what I don't want to see or what I don't want to know, and it helps me to not pay attention to something I should pay attention to.
Yeah.
Because it doesn't fit my paradigm of beliefs. And so it's like when people say, oh, I'm going to go out and buy a new car. Like, I'm going to buy a new Lexus RX 330, right? 350 now, whatever they are. And all of a sudden, it's like I see them out everywhere. Because now I've tuned my mind in to pay attention. And so it might seem like, I never realized this was such a popular car. Well, it was popular before I directed my attention to it.
Right.
It's just that now that I'm directing my attention to it, I'm noticing it more.
Yeah.
And that's the power of notice and name when I say to a client, what if you just paid attention to, you say, just noticing how many times you say, well, that person made me.
Yeah.
That seems like so small. And to your point, easily discountable. It didn't cost a lot of money. It's not really hard to do, so it must not be valuable. And shifts can happen very quickly when you start to become aware of this. One thing I noticed when I first started using this assessment is that people don't know what they feel, and it was really perplexing because they didn't go over this at all in the certification. And I'd sit there and I felt like, sometimes I could tell like my client probably wanted to hit me.
Yeah.
It's like they'd see the results and it's almost like they feel like
Then all of a sudden you're the problem.
Yeah,
Once you,
and I'll say,
Yeah.
these are your results. I didn't take the test for you,
Yeah.
right? This is your assessment. These are your results. What do you
Yeah.
make of it? And it can be really hard for people to see it, especially when it comes to anger. I'll have people say, a lot of people index high on anger. And it's like, well, I'm not an angry person. Okay, what about frustration or irritation? Oh my God, yeah, I am so frustrated. Well, frustration is a form of anger.
Mm-hmm.
So we language it in a way that makes it feel more palatable to us, but then we're not really in touch with what we're experiencing.
Yeah. I do acupuncture, so Chinese medicine, tongue pulse diagnosis,
Mhm.
and I don't know if you've ever had acupuncture.
I have.
You have?
Was it on you?
Yeah. Did they do tongue pulse diagnosis?
Mm-mm.
So basically it's an indicator, acupuncture basically, Chinese medicine, how I learned it's balancing the yin and the yang, but
Mhm.
the more and more I researched the history of acupuncture, and some people call it Asian medicine because you had like Mongolians, they would do everything from, they were actually one of the first to actually do chiropractic, and they would do their own tongue pulse diagnosis or pulse diagnosis, and they alluded an irregularity feeling in the pulse as a moral disorder. So it's very interesting, learning what I did about balancing the yin and the yang throughout the body with the acupuncture, and then hearing that, and then like that ties into so much. But yeah, just balancing things out, becoming aware. It's just so intricate what we're just not aware of, and that's what Asian medicine for the most part is about. Basically getting you aware, watching what you're eating. There's all these signs that give us details about what may be going on within you. That's what's so cool about that. So all this stuff is actually the mental emotional part of it. So like a wiry pulse could mean you're frustrated and irritable.
Mm-hmm.
So that basically it feels like a wire,
Mm-hmm.
like poking up like this
Mhm.
versus a full pulse.
Mm-hmm.
And then you have like slippery pulse, a weak pulse. So that could mean you are angry, which is very common these days. People feeling frustrated and angry
Mhm.
with a lot of things, like you say.
Mm-hmm.
And yeah, it's interesting. So then I tie into. Then that's a great segue for me to ask, well, are you angry? What are you angry about? And then tie it into this too. So
And
that's kind of like a
sometimes
light
people-
bulb moment for me, if you will.
Anger often hides shame. So what you'll see is shame-based anger, because shame is the most painful thing that we experience because it's different than guilt. Guilt is I made a mistake. Shame says I feel like a mistake. Right? And so you'll also see people conflating being anxious with being angry, that they can't differentiate the different states. So I study a lot about marketing, so making a little jump here. I find marketing fascinating because you know what? Marketing works better than psychology, because marketing gets people to take action and do things that they want people to do.
Yeah.
Right?
Yeah.
So Louis Cheskin in the 1940s wrote a lot of books on marketing along with Dichter. And one of the things he said, and I have this book from like 1944, he's like, people don't know what they feel. He's like, that's why we don't ask them, like, you know, why did you buy that brand of water over another brand? And they'll give you an answer because they want to look smart, or they want to give you an answer that's going to please you, but it's really not the answer of why they buy what they buy. Because if you don't know what you feel, then how can you know what your motivation is? So I have these older books from the 30s and 40s on marketing and motivation, and it was like fascinating to realize that.
How much of it is people wearing a mask? So I've read Robert Greene's Laws of Power, and he's got a new book out I can't wait to read, but I've watched some of his YouTube videos talking about how people wear masks. So they want you, like you said, why did you buy this water? Well, it was because, you know, I don't know how you make up about buying Walmart water.
Or I like the bottle.
But what would sound good about buying Walmart water, you know?
Exactly. We hide because
we want to be perceived in this certain way,
right.
So it's like we have this, what do you call it? Basically not a projection, but basically this.
It is a projection.
It's a projection of, who we want to be seen as. And
but it's not who you are. Juice Merlot wrote a great book called The Rape of the Mind.
is that the ego? Is this all ego?
And again, like like goes into like what is ego? But it goes into people have been conditioned to consider who they are based on how they think other people think about them. So they gauge themselves based on like, oh, how do you think of me? Or how does she think of me?
So others form their identity to a point.
But they don't even know what the other person thinks. And so it's like, see how flawed this is? I want to assess how I think I am based on how you think I am, based on how you think I am. But how do I even know what you think? Like, how do I know that you're accurate in your assessments? But then I'm going to take what you think and I'm going to form my sense of self based on that. And this is what social media is all about. Like, I'm going to take these selfies. It's like my daughter's like, honey, maybe 100. I mean, how many pictures do you take of yourself, right?
Till you get the right one.
Wasn't this? And then I'm going to put a filter on it so I don't look how I look. So I'm not even going to look the way that I look, right? So think about this today. It's like, so I used to work for a company called Medicis Pharmaceutical, and we'd have some of the sales reps, like when I do presentations, they marketed Restylane and Dysport, right? So you have women who are like Botoxed up, who can't even move their faces. They've got like these fish lips. I was in a meeting once with somebody, I'm like, oh my God, I'm like talking next to me, I'm like, can you believe those lips? I'm like, that is, I mean, I wonder what it even feels like to have all the crap in your lips like that.
It's
Women don't
blatantly
even look
obvious,
like women.
right? Yeah.
It's like, you know, look at like the Kardashians today, the tiny waist, the big butt, the huge breasts. That's not even human. You actually have to have plastic surgery to look like what is being modeled is normal. But it's not normal. So we're living in a world that's so upside down. We're living in a world where technology has usurped nature, right? Where it's almost like Norbert Wiener, who did a lot of work, who was in cybernetics, wrote a book called God and Golem. And the golem is, you know, the man made of clay. And there's a lot of associations between that and the man that consumes technology. Because you were talking about consuming food, but we don't tend to think about consumption in terms of mental hygiene. We don't tend to think about consumption in terms of what am I consuming in my mind? What am I reading? What am I watching? Who am I with? What are my relationships with? What are the quality of the people that I'm with in my life?
And the more that you do this introspective work, to me, you study psychology, you see how far off, you know, postmodernism has drifted us into this idealistic, upside down land.
Utopia.
I can't even. Yeah, it's a dystopia. You're sitting here going, you know, I can't even watch Netflix. I can't find a movie hardly on there I'm just like, there's some agenda, I see the agenda, I'm just like, this is just boring to me, and I know what's going to happen, I know what it's just crazy. When's the last time you saw a good movie? I talk this about to everybody. It's like, where's the Bravehearts these days? Where's the Gladiator? You know, of course I like those types of movies, but I haven't seen, like, now, like, it seems to me, maybe it was just my own perception, you know, when I was younger, it is. At least once a month I was watching a good movie that didn't have some political agenda or some sort of perversion about it.
Well, it's perverse and degenerate. And that's what's being sold as normal today. So perversion, and this is all about cultural Marxism, is about using culture to break down society, right? To break down mores and morals. Like, oh, to be moral is just like to be, oh, you're so old-fashioned, that's not even fun. What's fun to people today? What is fun?
People say, hey, you're so 1950. I say, no, you're wrong. I'm more like 1850. Yeah. Yeah, it's crazy.
But it is crazy, and what we see is that there's more and more emphasis on conformity. You have to be like me, in groups and out groups, right? If you're not like me, you're the enemy. And people's worlds are really becoming much smaller than before. So there's a marketer I listen to called Chandler Pie, and he spoke about this back in April, saying that people are going to start to see each other as a source of the virus. And they are. I had a workout the other day, it was really tough, and I went to the grocery store afterwards not wearing my mask. And I had to cough just because it was like, I was still like trying to catch up like from breathing.
You're trying not to like
and
draw attention.
And I'm afraid to cough because I think people are going to think like, oh, look at her, she's not wearing a mask and she's coughing, she's spreading sickness everywhere. She's a source of disease. She's the toxic problem. Like Typhoid Mary, right?
Yeah, you're the problem.
But it's like, then I'm the problem because I'm like not buying into this. It's like, I don't have to wear a mask that doesn't even do anything to prove that I'm an okay person.
That news or latest study on that was pretty interesting. By the CDC, masks have no efficacy. And you're just like, all right. Yeah, it's such a bizarre thing, but like, it's been.
But that's why fake news was important, right? Fake news had to happen before Corona or COVID. Interesting now, Corona's COVID. So that had to happen in that way because you have to get people to a place where they can't believe they can believe anything. Just like there's no truth. It's like solipsism. Well, that's your truth. It's like, no, I'm sorry. There is truth in the world.
Yeah.
And I can discern truth and you can discern truth, right? I don't have to have the mainstream media being the arbiter and saying, well, here's the truth.
Gaslighting to the max.
Right, and gaslighting is the foundation. Gaslighting is the double bind, which is part of communication, which is cybernetics, which is how they knew they were going to break down society. So I came across this several years ago. I was reading a book and all of a sudden it was like, oh my gosh, after reading all these things, and I finally figured it out. They were going to use communication because communication is key. So it ties into attachment. So I feel like that guy in my big fat Greek wedding where every word is like, it's a Greek word. And for me, it's always like, it's attachment. Because what happens is that as you're an infant to a child, it's your mother talking to you and helping you to explain your experience through language. And that helps to create your mental model, right? Oh, honey, you look tired right now. Oh, you look sad. Oh, look at you. You're so happy. And so I then began to get my sense of self through language. And it's through language I can share myself with other people. So I began to gain my sense of self then through the acquisition of language also. So that's extremely important. And it's extremely important to have distinctions. The more distinctions I have about what I feel, the more I'm going to be in my body and know what I'm experiencing. So instead of just saying, oh, I'm just so pissed off. Okay. Am I frustrated? Am I irritated? Am I feeling hostile or rage? It's the ability to have a distinction of what the feeling is that really helps. So reflection is really important. I have to step back and reflect. Well, at some point, what am I really experiencing? You know?
And what triggered it, right?
Yeah. And I may not even know. So here's the other thing I say. My husband worked with this man who was just like, his name was Angel on top of it, but that's not too much information. But he really wasn't an angel at all. I came home from work one day and I hear him on the phone with him on speaker. I'm like, oh my God, if somebody talked to me like that, I think I would flip out. The guy was like so condescending and rude and like stepping on him like verbally, right? And so he ended up leaving and he was due a commission check. And I'm like, dude, like, where's the check? How come you haven't gotten paid yet? He's like, I don't know why. And I'm like, I know why. Because if you knew why, then you'd have to call them. And the bottom line is you don't want to call them. So you use the excuses, I have to know why, in order to think that I know what to do so I don't make a mistake.
Yeah.
I hear this all the time from, I don't know why I did that. And I was like, you know what? I don't care if you don't know why. What we know is what you're experiencing now. Like the client comes in, what we know now is that what's curious is that you say you're going to do these things and then you've been here 4 times now and I enjoy meeting with you.
Yeah.
But what's curious to me is that you say you're going to follow through with these things and nothing happens week after week. What do you make of that?
Yeah.
Is that something else that you've experienced in your life? Where else does this show up?
Yeah. That's I think she was the one that started, you know, my exploration, because when we learned psychology and, you know, we learned some in med school more than I did in undergrad, it's just so surface layer.
Mm-hmm.
And yeah, there's just so much more to it. But
ties into perfectionism.
We need way more of it.
Imposter syndrome, you know, like perfectionism ties in with procrastination because I don't really want to do it. If I do it, I might fail. It's like all of these things tie into what we call internalized core messages, things that you heard as a child. Like for me, it's like, do you have to be so sensitive? It's like, well, I guess not.
Yeah.
Can you be more like your brother? You know, I wish you weren't born. All of these messages that people get, you know, as children, that become your inner voice. Your inner voice in your mind is what you heard from your parents growing up.
Yeah.
And they're typically not positive, you know, like nobody's going to, you are wonderful, you are so successful and confident. That's not typically what the inner voice says.
Yeah. And it's interesting to me is like these traumas, you know, like say you had a healthy childhood where you had both parents for the most part, but then there was just certain letdowns where traumatic things just literally, you know, maybe for someone else it wouldn't be that traumatic, but for you it was. It was that traumatic. And then if you talk about it later on, of course, to your family or something like, well, I remember when you did this for some reason, you know, I've forgotten it, or like you said, most of the time they forget most of everything. And then if it's real traumatic childhood, they may not remember hardly anything.
And there's nothing, and that makes complete sense. So sometimes people feel guilty about that. You cannot lay down memory when the nervous system is overly activated and aroused. You don't, and this is why people who have more extreme insecurity don't learn from mistakes. This is why you'll see people who keep making the same mistakes over and over again because they don't learn. Because they don't grasp what happened in this moment. There's no reflection, there's no learning from it. And so you'll see people tend to make the same types of mistakes over and over again in their lives.
And that's because exactly...
It's due to the trauma. It's due to the fact that they don't learn. They're not recording it. It's not... It inhibits
so they're
learning.
forgetting? Are they forgetting? Or
they're not recording, or it's not getting anchored in.
Okay. Yeah. Just basically, here's what I did wrong. Here's what I'm going to do different next time. And
but
it doesn't process like that. Yeah.
No. And it's not because... And learning disabilities are part of this too. So dyslexia typically always correlates to insecure attachment. It correlates to the family. Learning disability, this is one thing that people will challenge me on, and I'm fine being challenged on it.
Yeah.
I know people don't want to know it. They'd rather think that it's not what it is.
We live in an age where there shouldn't be any repercussions really for any actions, right? You should always have another chance, you know, and you shouldn't ever feel bad, you know, about things. And it's just like sometimes you gotta look at the ugly to, you know, and cultivate that to move beyond things and grow as a person. But yeah, no repercussions. You should always have second chances, you know, no matter what. Anyway, it's not.
Or not feel bad. So I was talking to a friend of mine the other day.
Comfort. We live in an age of comfort. People they don't want to, because this stuff is uncomfortable.
And it's okay to be uncomfortable. So I said to my friend, you know what? You should be sad. And she's like, what? I said, I think that it's okay to feel sad over what you're experiencing right now.
Yeah.
And I don't think I think it would be weird to be feeling happy right now.
Yeah.
We are so, like, positive psychology, happiness, positive. It's like happiness is a
Dissociate.
Exactly.
Dissociate.
Happiness is a product, right? I just want to be happy. Well, what the hell does happy even mean, right? Exactly. I just want to be positive. Well, positive so I can bypass my experience, right? Yeah. So people are given so many good ways to bypass themselves in life today. You know, oh, don't feel bad. Be happy.
Yeah. Yeah.
You know? Well, sometimes it's appropriate to be sad. Sometimes it's appropriate to be angry. Like, so when I got my EQ and I
Get
saw...
comfortable being uncomfortable.
Exactly.
That's where the ice baths come in that I love. Wim talks about. Yeah. He says, you know, if you ask him, he said, I love the cold. It's my warm friend, because you get that rebound blood flow to the surface of the skin. Yeah, and then later he's like, no, I hate the cold. You know, just like, but he loves learning to be uncomfortable. And actually, these ice baths they actually do help. It's probably it's not the root cause type thing, but it can help people so much mentally and emotionally that I'm finding. But
well, and I'm going to say sometimes, like with some patients,
training them to go through something uncomfortable.
Exactly. Sometimes if somebody's really phenomenally depressed, it could be appropriate that they're going to be on SSRIs for a period of time. I'm not against all medicine, but I'm saying you can't medicate your life.
Right.
And so it's about recognizing when it's appropriate and when it's not. It's about what else can I do? What might be hard? What's going to help me? Where's my motivation to do something that's not easy? Yeah. It's like, you know, I had a situation at home with my daughter and I did something and I took pretty serious action. And she said, why did you do it in that way? I said, because you know what? If I didn't and there was an element of fear involved, you'd keep doing what you're going to be doing.
Right.
You know?
Yeah.
It's like we have
and that's like an art, right?
Yeah, it is.
Being able to instill enough that's actually going to be therapeutic for them, but like say not excessive where it's kind of like...
Not to be punishing and threatening,
right?
Yeah. Because for a parent, so this is a really hard thing as a parent, is I have to be able to tolerate setting a boundary with my child, and I have to deal with the distress because my child's not going to like me, and I can tell you how to go through that. Where
if you're all about them liking you, then it's more about you than what's best for the child. That's parenting 101.
I had to deal with
do what's best for the child.
Yes. I had to deal with my daughter being
probably not gonna like you when you do that.
Exactly, and I'll tell you, it makes me feel I don't want her to be mad. I don't want her to be uncomfortable. But I know if I don't hold that boundary in that way, I'm not helping her.
Yeah.
Right? I told my daughter, I will never be your best friend.
Yeah.
I will always be your mother.
Yeah.
You know, because this whole thing of parents just say, oh, my daughter's my best friend. It's like, no, you have friends. Your daughter doesn't need to be your best friend. Your daughter needs you to be a mother.
Yeah.
Just
I think that right there is, definitely a core fundamental issue. Yeah, there's so many parents just, like I said, their parents might have raised them the same way. And so maybe it would help them learn to grow up to know that it's maybe not all their fault, because maybe they know they're probably not, or they could be a better parent. But it's unbelievable. Let me feed my child this because he wants this. French fries. He won't shut up. He won't eat nothing. It's like, well, he don't eat.
Eventually,
he won't eat lunch then. Yeah. It's like my dog, I leave him every now and then for 2 days, and I put this automatic feeder up where he's got to stick his head in and eat the food. At first he was being all, because he's emotional and all that, but right now it's beautiful weather in Phoenix, Arizona. I got an automatic waterer too for him, but he's fine. He's got a nice dog house with lots of pine shavings in there, and he used to sleep out in the cold, like 30 degrees in Tennessee. He's fine with 45. He's got a big fur coat, guys. But anyway. Yeah, it's like, of course I had to kind of train him to go in there, and he was being all weird about it, but it's just like, I'm just like, he'll figure it out. Of course he was. Like when I'd go back in, I'd watch him, and then he'd go over there and start eating out. When he got hungry, it's like, who's conditioning who?
Right.
Who's parenting who?
Exactly.
Who's the one in control?
Right.
That's the thing these days. These kids are in control.
And that's not
They're manipulating their parents.
It creates profound insecurity in the child when there's a role reversal, when the child takes care of the parent and the child feels that they have to please and take care of the parent in that way. It causes profound insecurity in the child. So that type of role reversal that's been fomented in our society is not healthy at all for children. People don't feel secure when they feel like they're going to be their parents' BFFs, right?
Right. Yeah. How could they?
We really are quite confused, and I was
participation trophies.
Yeah, exactly. Well, everybody gets an A. I was reading Eric Fromm's.
The irony there, in an attempt to protect the feelings. This is Ed Lattimore. I love this guy, but he posts a lot of good stuff on Twitter. in an attempt to protect the feelings of losers with participation trophies, more losers are created.
It kind of goes into Ayn Rand's work, who I really, my own bad, it's like I minimized some of what she did because of some of her thoughts, but she speaks about this, about there's a lack of morality for equality. This whole notion of equality basically states that nobody can be exceptional, everybody has to be mediocre, right? And that the people who are the weakest demand the most equality because they don't want anybody to demonstrate what they're not willing to do, right? So everybody gets an A, everybody's equal. But what do we get in a society like that, right?
Yeah. Nietzsche, do you read much of his work? Yeah.
The slave wants to believe that they can be the master.
Yeah.
So Nietzsche's...
And for everybody that's out there, we won't get into this, that African Americans aren't the only people that were ever slaves. There were slaves of every race on this whole, and there's still slaves in China right now, so we'll get off this, but yeah, just because it's, that's not, he called it master and slave morality, is exactly what he called it, but I encourage everybody to read Nietzsche's work, Beyond Good and Evil.
Yeah.
To understand, I tell people all the time that, in politics, the left and the right, it's like people think they're arguing their facts. They're not arguing facts, they're arguing their sense of morality and what they believe to be morally right and wrong. Like that's the foundation of it, and then you look at politics like that and you're like, oh, yeah, it's crazy. Nietzsche, oh my gosh, that guy.
There's another book along those lines, Egalitarian Envy, where he talks about some of this too, where the people...
He wrote that? Oh, you got
No. Egalitarian Envy was written by somebody else. I can't recall the author off the top of my head. But he speaks about these types of dynamics of the slave and master, and the slave wants to believe, like in today's world, this is the manipulation. The slave believes they're the master, right?
Yeah.
But they aren't.
Right.
So they're leading this fake life thinking that they're much more powerful than they really are, but they're doing exactly, via the use of military mimetics, they're doing exactly what they've been predicted that they're going to do. People are not as unpredictable as they think they are. They're much more predictable. And the way to be unpredictable is to have a mind. The way to be unpredictable is to be able to critically think, is to reflect, is to be able to tolerate seeing yourself, is to not blame other people for what you're experiencing in your life. It's responsibility and morality.
Yeah.
And that seems so old-fashioned today.
Yeah, that's the most scary part, is morality is old-fashioned these days.
Anything goes.
Anything goes, Yeah, your beliefs, whatever you believe is what you believe, and then that can be your truths, and you're like, no.
But that's New Age BS. That comes out like from Changing Images of Man. That really came from the CIA and intelligence, this whole notion that, well, that's your truth. The whole New Age came from the CIA, right? Because they wanted to engage people in superstition and magical thinking. So it makes people much more manipulative, be able to be manipulated, rather.
Yeah, it just makes you want to just take, all the millennials, no, I'm not too far off from them, but take a lot of these 20-year-olds, fighting in the streets right now and throw them all out in the wilderness somewhere and say, fend for yourself, and like how much reality that would instill in them. It's just like, people, to me, reality is nature. So the more far removed, and as a naturopathic physician, what I'm seeing is the more far we are removed from nature, the fatter, sicker, nearly dead we get.
People don't move.
Mentally unhealthy.
People aren't moving. It's like Optima up the street here, where now you're seeing the buildings being built up, and now there's like, oh, it's so green, it's so pretty. So they're creating the smart cities, right?
Yeah. So
Phoenix Scottsdale's a smart city.
Yeah.
And so instead of living in nature, people are living in these stacked smart cities, right?
Yeah.
So they're like riding their scooters and their bikes, because God knows we don't need anything. It goes into the World Economic Forum.
Yeah.
It's like I own nothing, I have no privacy, and I've never been happier meme is what they're trying to solve.
Yeah.
Why?
Why? Yeah. A lot of whys.
To be better consumers, like what's coming out of when people say this next new normal, what they're fomenting is the next new normal consumer. They're getting people used to buying in different ways. They're getting people used to having somewhat less. Now you're seeing the talk about basic universal income today. I want my needs met ties into utopia. It ties into infantilism, which ties into attachment.
No matter how I act, no matter how I behave, I want everything, the rich have.
But that's the
and they should
infant.
share with me.
The infant's needs that got met because it couldn't be met, right? So everything was effortless, right?
Yeah.
Should be as an infant, right?
Right.
But that's this desire for utopia is insecurity, attachment.
So that's where entitlement comes from too.
That's where it comes from.
Yeah.
Yeah.
I think we're running out of time here. Kathy, thank you so
Thank
much.
you.
We're going to have to do more episodes.
I'd like that.
Yeah, this has just been amazing. I can't thank you enough for being on today.
Well, thank you very much for having me on.
Yeah.